My beloved mother, Dr. Sudha Sachidanand, an obstetrician and gynecologist, started her practice over 40 years ago in a modest, rented, small 2-bedroom house in a newly developing part of the city. Being the only doctor in that area, she worked tirelessly, several times outpatient consultations running beyond midnight, and would take emergency calls for deliveries in the middle of the night. And all this while raising 2 young children at home. In fact, some of my old patients and neighbors even today come and jokingly tell me about how they would see Dr. Sudha rushing on her Luna in the dead of the night to deliver a patient. My doting father, Dr. Sachidanand Murthy, an orthopedic surgeon in government service, supported her whenever he could, despite being frequently posted away from home. Fortnight weekends, he'd come home and regale us with stories about his experiences in these rural areas, the hardships that these simple rural folk would endure, and his desire to improve their accessibility to health care. A dream that is now reflected in the establishment of our healthcare facilities in these very same communities. After his retirement, my parents chose to do even more. With determination, courage, and a loan that they could scarcely afford, kids were growing up and college education was not cheap even back then. Still, they embarked on an ambitious journey of building their first hospital, Srinivasa Hospital, thus laying the foundation for a legacy of compassionate healthcare and service to the community.
During the first half of the first decade of this century is when the nursing home started to grow into something a little bit more, started to grow into a hospital. The first steps for this was taken by Dr. Sudha, Dr. Sachi, Arjun, Archana, all of them together as a conscious step from growing from a small nursing home to a hospital. The first steps required recruiting different specialties, growing other departments, and these were the challenges that were faced during the first decade. At this time, one of the challenges faced was additional services had to be provided, additional facilities had to be prepared, new personnel had to be brought on board, training of new type of nurses had to occur. With all of this, the first decade was a busy time in the life of the nursing home. Subsequently, it grew even busier because there was a decision taken that we will focus on patient care, health care, and reaching that to a larger and larger number of people. And for this, the institution joined hands with several microfinance institutions, insurance companies, and all of these processes allowed the hospital to reach out to a set of population who could perhaps otherwise not have afforded any health care. And this is one of the ways by which the institution was able to engender trust within the community. More and more people came to look upon this hospital as a place where they could go for their healthcare needs. This was, of course, a positive growth, but it had a lot of problems too. There were challenges. Turnaround time on payments from insurance companies was very long. Margins were very narrow. Despite these challenges, with the able guidance, the sage advice of Dr. Sachi and Dr. Sudha, the hospital only grew from strength to strength. Another important focus during this time was on team building. Building not just medical teams, but also nursing teams, administrative teams, teams to handle every activity, including outreach. So all of this put together made the hospital a vibrant, active, growing, dynamic operation. This allowed or laid the framework for, it laid the groundwork for the next phase of the growth of the hospital from one to many.
When I finished my medical degree, I had one plan: join a corporate hospital, build a safe career, and let someone else handle the rest. But destiny had other plans. I was the first doctor in my family. On the other hand, my husband comes from a family of doctors. For him, medicine was a legacy. For me, it was a dream we were writing together. Two different starting lines, same finish line. In 2013, when we started our first hospital, it was one building, one dream, and 1,000 sleepless nights, and a lot of coffee, of course. Those early days were tough, 6 a.m. to past midnight. Why? Because we couldn't afford a duty doctor. So we became the day doctors, the night doctors, administrators, even plumbers. If it was broken, we fixed it. People asked, when do you rest? We said, what's rest? In those long nights, we learned our purpose. Villages and rural areas had no access to quality healthcare that cities take for granted. A farmer with chest pain couldn't travel 100 kilometers. A mother in labor couldn't wait. That's when we knew if patients couldn't come to the city, healthcare would go to them. In 2014, we opened our first spoke in Yelandur, small but full of hope. Then came a World Bank grant. With that support, we acquired our first hub hospital, today's Disha Hospital in Mysore. That hub became our heart and the spokes became our arms. And yes, the grant meant that we could finally breathe a little. The road had challenges, financial stress, equipment breakdowns. Nights we wondered, will this even work? But we had one thing that never failed us, a strong team. They believed in the mission. To them, we owe everything. They carried us on the days we couldn't. Along the way, life gave us two beautiful children. And yes, the doctor-parent guilt. Missed bedtime stories, missed school functions, the times our kids asked, when will you come home? And we didn't have an answer. But through it all, my husband, Dr. Arjun, was my mental support. Basically, my human antidepressant. 24/7, no prescription needed. And my parents took care of the kids. To my parents, thank you. This journey is ours, not just mine. Today, from that one hospital in 2013, we've grown to 20 hospitals, 2 hubs and 18 spokes. We see 500 patients daily, over 7,000 surgeries to date, at a cost rural families can afford. We started by filling a gap in rural healthcare. Today, quality with affordability is our responsibility. From 1 to 20, from a first generation doctor to a legacy and a team serving so many people. Destiny doesn't ask if you're ready. It hands you a stethoscope and says, start. Thank you to every patient, every team member and family who sacrificed with us. The journey from 1 to 20 was just the beginning, because healthcare isn't about how many hospitals we build. It's about how many lives we don't leave behind.
"40 years ago, we started with one room and one dream. Today, we are 20 hospitals. Tomorrow, we aim higher. With a clear vision and goal to set up 200 hospitals by 2030, Sudhanand leaps forward. We are not waiting for the future. We are building it. All the infrastructure and support mechanism needed for this scale are already being put in place. We have already moved beyond hospitals. Sudhanand Pharmaceuticals Private Limited now manufactures 31 fast-moving medicine brands that our patients trust every day. And we won't stop at India. With expansion plans in Europe, Russia, the Middle East and Africa, Sudhanand products will soon be available globally. Healing made in India for the world. We saw the need for safe blood, so we built CurePlus Blood Bank, the only standalone blood bank in Mysore with state-of-the-art facility to store 2000 units. Because no surgery should wait for blood, no life should be lost for lack of it. We saw villages that couldn't reach us, so we decided to reach them. Our team designed the first lab in a van model. Today, 4 mobile labs run under the banner of Sudhanand Arogya Vahini, taking diagnostics to the remotest rural population. Healthcare should not depend on a person's PIN code. But today, what started as a hospital to serve the poor has branched into new directions. We built ARC Sports Zone, the first and biggest sports academy in Mysore, with 6 indoor badminton courts, an Olympic-sized swimming pool, a cricket stadium, a futsal arena, 3 restaurants, table tennis, karate, pickleball, and many more sports under one roof. Because a healthy nation needs more than hospitals. It needs to inspire its youth to dream big and make it big. We have stepped into hospitality with our hotels in Mysore, Goa, and Bangkok, bringing the same Sudhanand warmth and services to travelers across the world. And we are already on the global IT and AI stage. Through Sudhanand Business Solutions, we work with leading insurance providers in the United States of America to build, maintain, and innovate their needs in claims, catastrophe modeling, software development, and AI tools. And with Mindwork Technologies, our newest company focusing on AI development, we are knocking on the doors of ISRO to take Sudhanand to space soon. This is how Sudhanand has moved forward, and this is how we intend to keep moving, by serving poor communities, by building what India needs before India asks for it. From 1 to 20 was a journey of ethics and hard work. From 20 to 200 will be a journey of scale and soul. My parents started this to serve. My promise is that we will grow, but we will never outgrow that purpose. The future is bright. 40 years of healing, one family, one vision. Thank you.